News 3 reporter Dave Delosier spoke today with mental health experts who believe suicide is an issue that really needs to be confronted.
Yeah, Michelle and Eric, you know, if you want to get a sense of why this issue is so important and why it needs to be addressed, consider this. Now, consider this. Suicide claims more lives in this country than auto accidents or homicides. Mental health care experts believe that the only way to deal with this issue is to educate the public.
Fussy. I was shocked, but not surprised.
Through all of the laughter he brought, there was another side.
Mindy, run for your life! The emotions are coming!
A side hidden from the world of depression and substance abuse. A side that those who work in mental health care know is there.
Very often, if you talk to survivors of people who've died by suicide, they will express shock and disbelief that the person could have ever contemplated something like that.
Every time I hear about a suicide, it rips my heart out.
Linda Seeloff understands the pain it brings better than most. She's lost 2 family members to suicide.
When you lose somebody by suicide, it's a different kind of a loss. And it's really a lifelong process of healing.
That healing process now has Seeloff working to try to help others coping with suicide. She volunteers as a facilitator for survivors of suicide at Journey Mental Health.
No, it never goes away, but the questions cease because you have to come to peace with questions that really will never be answered.
The loss of Robin Weems is bringing the issue of suicide out of the shadows. It is doing what experts in mental health care say is important. It is letting people know that with help, with effective clinical care, it doesn't have to end this way.
It is critically important, and we know from our experience in the mental health field and from vast amounts of research data that early intervention makes a huge difference.
And that is maybe the most important takeaway from all of this, and that is that suicide is not an inevitable conclusion, but it is vitally important to get effective mental health care. To that end, here are some very important numbers for anyone contemplating suicide. There is help by calling the Dane County 24-hour emergency crisis line at 608-280-2600, and you can also call the National Suicide Prevention Line at 1-800-273-TALK or 1-800-SUICIDE. And Eric and Michelle, we've placed some additional resource information on channel3000.com. It's posted right now for anybody needing that information.
I hope someone will go there if they need the help, and if you've ever been touched by suicide, it's something that stays with you forever.
Absolutely.
Thank you, Dave.